My name is Emily Rouse. I'm 32. I'm a mom to a rambunctious, hectic 7-year-old boy. Have always been a nurse by trade, and was very active up until last year. My lupus really hit me hard and was kind of put in a tailspin, and ended up hospitalized for about 12 weeks. I was initially diagnosed at age 16 and went with pretty traditional treatments up until last year. And I'm treated for both, lupus, rheumatoid arthritis, and shrinking lung syndrome. I was on some pretty heavy-duty pain medicine. I was on 100 mic fentanyl patches, which are end-stage cancer doses. I was on thirties 4 or 5 times a day. I was on a milligram of ativan 4 or 5 times a day, and I've been able to cut basically all of that out with the medical marijuana. I've done everything from pediatrics to hospice, and I had seen some limited use of medical cannabis with hospice patients on their own accord, and really saw the pain management differences and how their quality of life was able to be better with that. So it sort of opened my mind to possibilities with myself. I've been treated with the medical cannabis since March of last year. Since then, reiterating, I came off the fentanyl, the oxy, the ativan, and on all those drugs, I mean, quality of life was nothing. I couldn't function well enough to play with my son, to spend time with him, to do things with him, to spend time with family and friends. And certainly with the medical cannabis and coming off all the narcotics and opioids, I'm able to, function as more so myself these days, as well as my pulmonary function tests have changed drastically. My diffusion capacity went from 0.14% to about 85% within the last year. And so we're hoping to get me back to work within the next year, depending on how disease process goes. I was nervous going in, and I saw Dr. Dorn, and it was just a wonderful experience. He was very reassuring. I don't have any, of the ill side effects. I don't have withdrawal symptoms, anything like that. My pain levels and such will go up, as I'm needing the medication, but there aren't any withdrawals or bad side effects. I don't get shaky, I don't get chills, I don't get nauseous, anything like that, like I would with, the oxy or the fentanyl. I think that the laws need to be loosened so that it's available for more patients, and that so that more people can benefit from, the medical cannabis products. A lot of people are misinformed as to the issues that go on with it, and there are so many other chronic conditions that could be treated a lot more easily on the patients, a lot more in a lot more healthy manner than a lot of the medications they are taking to treat different disease processes, and either ineffectively treating them or having side effects from other medications that wouldn't happen with the medical cannabis. Give it a shot. I would much rather put medical cannabis in my body than these different drugs that come from drug companies. And no, I mean, don't get me wrong, there are certainly medical therapeutics that are wonderful, and I'm still on medical therapeutics, pharmaceuticals, but I don't think that there would be any drawbacks for anyone to try it. I'm much more able to do the things that I want to do and feel up to doing with my child, with family, with friends, rather than being drugged out all the time and not feeling up to doing anything.